And I think this is the last slide that I will be going over, which is that we do have a new FAQ, an FAQ on interpreting hepatitis A concentrations in wastewater. And so we invite you all to have a look at it and use it. And if you have any comments on it, let us know. But we've had a lot of questions from people off and on about what is HAV? How is it transmitted? What does it mean if you measure it? How should we interpret it? And so we've tried to provide some answers to all of those questions in one location. So please feel free to look at this and offer us any suggestions if you have them when you look through it, even if it's just a very quick email with suggestions. And I think with that, I will pass to Marlene.
Thanks. Okay, hi everybody. Allie just mentioned that we're not currently running the H1 assay, and so we just wanted to kind of go over that quickly again and explain why. So the H1 assay was designed using sequences through April 2024. We had deployed earlier this year. There were quite a few new sequences that were deposited over the summer from all across the US. Mostly because there was more sequencing of clinical isolates happening this year than in previous years because of kind of typing as part of the effort to look out for H5N1. So we're fortunate actually that there was kind of good sequencing data, but there are mutations recently in the region of the HA gene that are H1 assay targeted. So that means that it has not been performing well, and we are working on a new assay now. So we are still in process of working on that assay. The H3 and the H5 assays are still working. There's no issue and there's no change in kind of the areas that are targeted for those subtypes of the virus. But viruses like influenza A is particularly well known for evolving quickly, and so it's something where we need to kind of constantly be checking in to make sure that the assays are performing well and that they are giving us the information that we think that we are getting. And so we are not sharing H1 data during a time period where we know that the data that we might generate doesn't actually represent the H1 that's circulating. So we will continue to update you when we have more information about that. I also want to go over a little bit of our kind of recent H5 influenza detection in wastewater. So as of yesterday, we've had 167 total positive detections out of 11,611 samples analyzed. So, the vast majority of samples that we've tested for H5 since May 15th, when we started doing this, have been non-detect for H5. However, we have had, a very interesting pattern of findings of positive H5 samples across the country, including detections at 37 sites across 9 states. Most of our recent detections are in California, and the detections overall that we've seen across the country have been fairly consistent with locations where there are known outbreaks in cattle. So there's a lot more for us to do still to understand exactly what these measurements in wastewater reflect in terms of the different possible infections in cattle and other animals in communities, but we have seen that alignment between the locations where these outbreaks are happening and the locations of detections at a larger scale. We just wanted to share this quick plot. It's a histogram of the H5 concentrations that we've measured in wastewater. You can come back and reference this too if you're, one of these sites that does have recent detections and you're curious to understand, well, how high is that? Is that number really kind of close to the detection limit, or is it one of these really, really high values that, we've seen occasionally. So you can just see the frequency of samples that have concentrations that are measured in each of these bins. So less than 1,000 copies per gram, 1,000 to 5,000, 5,000 to 10,000, 10,000 to 20,000, 20,000 to 50,000. And then we do have, kind of a number of detections where the quantity measured is greater than 50,000 copies per gram in wastewater solids. So I think we're kind of mostly putting this here as a resource and to give you a sense of the distribution of what we're measuring. A lot of our measurements have been in this relatively low category, but there's a pretty significant number that have also had very, very high concentrations of H5 measured. I want to just kind of preview for everybody this H5 modeling effort that we've had going on. Abby Paulus, a postdoc at Emory, has been leading this. And the question is really how much shedding of H5 influenza into wastewater is required to create the concentrations that we observe, knowing that there are multiple different species of animals that could be shedding H5 in a way that ends up in wastewater. So the model estimates the contributions into wastewater in terms of the liters of infected milk, the number of infected poultry, the number of infected wild birds, and the number of possible infected humans based on data from the literature describing what concentrations of influenza and, when we have the opportunity to find that data, actually H5N1 influenza are shed by each of these different species. So this is just a nice graphic showing all of those different possible contributions that I just described and how they might get into wastewater. Yeah. Can you hear me? Is something going on?
Yeah, no, it's good,
Oh,
Marlene.
okay. So other factors to consider are, does that contribution actually end up in wastewater, right? In the case of infected wild birds, that might have a different likeliness of ending up in the sewer compared to cow milk. How good are our assumptions about how much shedding is happening and the data that we have to feed into this model? That's a limitation. And what about multiple pathways, right? And we know that it's not necessarily exclusively milk or exclusively poultry that's going down the drain. There could be a combination. So we'll be sharing a preprint and a tool to actually utilize this model in the upcoming weeks. And also just want to plug a request. We'll be sending out a short survey to utilities to request more information about sewer system inputs as we think about the way that in this case for H5 and possible other kind of industrial and system specific features may impact our detection and interpretation of data. We want to check in with everybody about some of those kind of key elements of your system that will help us understand the data as best we can and help you interpret it. So look forward for more on that. And then finally, we have this FAQ for H5. This is the same one that we've shared before, but we want to make sure that you know that this resource is there to help interpret what we're seeing in wastewater for H5 specifically. And I'm going to pass it back to Allie.
Okay, so just an update on the mpox assay. Next slide. So remember, we have been discussing how WastewaterSCAN has been conducting R&D to test mpox clade 1b assay that exists because there has been concern about mpox clade 1 coming into the US, and the strain that's currently circulating in Africa and a few other places is clade 1b. And so we've gotten to the point now with our workflow, which we've shared this with you quite a bit about how we actually do the R&D and get to the point where we're ready to scale an assay. We've done all of the work. So we've tested the assay sensitivity and specificity. We've done some retrospective testing of samples and found them to all be negative, and we expect them to be negative even when there's higher levels of mpox clade 2. And so what we expect in the wastewater clinically, which is nothing, we found nothing. So technically we are ready to scale this assay if we decide that we would like to. The one issue that we would have to wait on is we're still dealing with some select agent issues from CDC, and the update there is that the select agents group is evaluating whether they can make some changes to the select agent rules that would allow nucleic acid detection of select agents without tripping all of the select agent issues that come up, and they're still considering the change of the rule. So until we get to that point, we would not be able to scale this assay since mpox clade 1 is a select agent. But on the other hand, we are interested in hearing from you all if this is something that you are interested in having information on mpox clade 1 or not. So if you want to put a note in the chat or send us an email, we'd love to hear from you. And if we do get to the point where CDC would allow for detection of clade 1 without, issues for the sampling that would be driven by select agent issues, if that's not an issue. Sorry for using issues so many times. We would use the same protocol that we've always used with you all, which is that we would send a note and we'd say, we're ready to scale this assay. We're thinking we could scale it in 2 weeks, and we would be sunsetting something else, probably rotavirus. Please let us know if you have any comments or concerns, and then that would give you all time to send us a note, and then we could decide whether we want to do it. But in the meantime, even though we're not at that point, we would love to hear from you. And yes, the issue, and I don't want to spend too much time on this now because I see some questions already coming up in the chat. The specific issue is that if you collect a sample from a wastewater treatment plant and you give that sample to WastewaterSCAN, and it's like a bespoke sample and that's all the sample, then we actually can measure clade 1 in that right now. And if we detect it, there's no implications for the wastewater treatment plant or anybody. We would have to fill out a form, destroy the sample, that we could all do. So we're already set. And that's how we did the retrospective testing, is we work with samples that we had the entire sample here. So if we did detect something, we would just destroy it and follow the rules. The issue that CDC is trying to address is that if you collect, say, a very large volume sample, and part of that goes to WastewaterSCAN and part of it goes to measure TSS or other things that you might have to measure for permitting purposes, or some of it goes in your freezer. So, and then the sample you send to WastewaterSCAN, we detect clade 1. The rules as they are now say that then we would have to go back to all those different aliquots of that sample and destroy it, which we know is impossible. And we're not going to do the clade 1 testing because of that, because if we had to go back to every plant and say, do you have any archived of the archive sample from this date, that you sent us, that would be a huge amount of work, and it would disrupt the workflow. It would disrupt adherence to permitting and that sort of thing. So that is why we are not scaling this clade 1 assay while that rule is in existence. So I hope that answers some of your questions and explains why in some cases we are able to measure clade 1 without worrying about consequences to the plant, and why in some cases it is actually a big deal and a consequence to the plant. So I hope that makes sense. It's not necessarily logical, but that's the rules. Okay, next slide. So yes, this is the assay if you'd like to look it up and read about it. Next slide. Just a reminder that we do have some ongoing research projects that we work on. These projects we do them in collaboration with Verily, who are our laboratory partners. The first project we mentioned last time was on parvovirus, and I'll show some preliminary data from that work. And then we're also working on some research related to pertussis, which causes whooping cough. And then we also are working on a project on antimicrobial resistance genes, which we have discussed before, which is like a cross-sectional look across the country of distributions of these genes and how they relate to information about prescriptions of antibiotics, as well as other information about the locations where the samples were taken. And for this project, we're sort of binning stuff together at sort of the state level. So it's not about looking at one specific plant and pinpointing like, hey, look at plant A, it has really high levels. That's not what that project's about. For the work with parvovirus and whooping cough, we're working with specific plants that have been involved and engaged in the research. And so those are at the individual plant level that we're working on, looking at these and some older samples that are archived. Next slide. I wanted to share some of the parvovirus work because it's pretty interesting. You all may remember from, I guess it was a few months ago or longer, that there was a lot of news stories in the popular press about how parvovirus was infecting children and others, and it produces an illness that presents with flu-like symptoms as well as rash, especially redness on the face. And so we actually have access to this database called Epic Cosmos, which is a research database for looking at aggregated information on different diagnosis codes across the country for clinics and hospitals that use the Epic software. And so we have access to that here at Stanford. So we actually identified one location in a sewer shed in Texas that we work with that actually had quite a few confirmed cases of parvovirus. And those confirmed cases are shown as a function of time each week on the top axis of this plot here that says confirmed cases on the left. Marlene, maybe you can point that out there. And so you can see in this particular county, there were at most 30 cases in a week. So it's not like a huge number of cases. And then we worked with the plant and we measured parvovirus in the samples that were archived, which is on the bottom, where it shows the concentration of parvovirus in copies per gram. And you can see here the nice correlation between the wastewater and the Epic Cosmos data. So we'll be working more to write this up in a paper because we're academics and we're nerdy and we like to write peer-reviewed papers. And we're going to be sharing the methods that we use and the assay that we use. Right now, this isn't an assay that we would think about scaling at this time, but we'll have it ready in case next year parvovirus ends up being a bigger deal and there's a lot of interest across all of our partners in measuring it. For example, there'll just be another tool in our toolkit for the future. Okay, so I think I took a long time here. It's time to pass on to Marlene or Amanda.
I'll take over from here. Thanks, Allie. So I just wanted to remind everyone that we sent a couple of emails a couple of weeks back talking about our new public health roundtable series that we will be launching in December. And so these series are meant to be kind of a space for public health and wastewater treatment plants to learn from each other of how they are using the wastewater data in their daily operations and going into respiratory virus season. So our first event is going to be in early December, and we will have 3 great speakers from our network across the country who are going to be sharing how they are using the wastewater data going into respiratory season. So we will send more information about this in the coming weeks. Next slide. Okay, now we're going to dive into the current wastewater categories. So just as a reminder, categories are based on levels, trends, and frequency of detection. And Stephen, if you could add a link to the chat for more detailed information on the categories, that would be great. Thank you. Next slide. Quick reminder, so we have 3 archetypes. So we have pathogens that are commonly detected regardless of season, and that applies to SARS-CoV-2, norovirus, rotavirus. And then we have seasonal pathogens that are rarely detected outside of seasons. So influenza A, B, RSV, human metapneumovirus. And most recently, we added EVD68 to this category. So prior to October, EVD68 had been in the pathogens that are not commonly detected. The reason we switched it is we started to see more frequent detections and higher concentrations across the entire WastewaterSCAN network starting in August. And I'll show some plots about this later. So we switched the pathogen category here due to the commonly detected aspect of what we're seeing this year in samples. So next slide. So I'm going to go over quickly where we're at as of today. So if you go onto the website, this is what you will see. So for SARS-CoV-2, we're currently in the low category, and this is due to low concentrations and a downward trend. Currently, 56% of sites in the WastewaterSCAN network are in that low category. So we've come down quite a bit from the peak that we saw during the summer. Influenza A is in the low category due to not being in seasonal detection yet. We currently only have 5 sites across the country that have hit that seasonal onset metric. Influenza B is also not in seasonal onset. There's only about 4% positive detection rate for influenza B across all of our sites. RSV is currently also not in seasonal onset and in the low category, but around 29% of samples have had positive detections in the last 21 days. And most of these positive detections have been happening in the southern region where we have sites. So particularly in the Atlanta metro area and southern tip of Florida. Human metapneumovirus is also in the low category due to not being in seasonal onset. EVD 68 is in the high category, and that is due to high concentrations at the national level, but there is a downward trend, and I will go into this a little bit more later. Neurovirus and rotavirus are both in the high category due to medium concentrations and an upward trend. Neurovirus has been detected in 100% of samples in the last 21 days, and rotavirus has been detected in 70% of samples in the last 21 days. Mpox is in the low category. There have been no positive detections in the last 21 days. C. auris and Hep A are both in the low category due to very few positive detections. There's only been 19 positive detections for C. auris in the last 21 days, and Hep A, there's been a 13% positive detection rate, with some sites experiencing more frequent detections. Next slide. So we're going to go into SARS-CoV-2 a little bit more. As I said, SARS-CoV-2 is in the low category currently due to low concentrations and a downward trend. Levels are a little bit, the medium concentration is a little bit lower right now than it was this time last year. So we've kind of hit this low kind of plateau, and we will continue to monitor it as we go into respiratory virus season. Next slide. For SARS-CoV-2 sequencing, just as a reminder, we're doing sequencing from a handful of sites across the WastewaterSCAN network, and this is the aggregated sequencing plot on the right. Currently, KP.3, which is this light blue color, is making up about 40% of what we are seeing, and then JN.1.11 in the green is making up right around 35% of what we are seeing. Next slide. Here's a quick map of where we're at for SARS-CoV-2 across the country. As you can see, the West and the South are in the low category, and the Midwest and the Northeast are in the medium category. Most sites, like I said, 83 sites out of 147 in our network are in the low category. Next slide. EVD 68. So as I mentioned, EVD 68, we're still in that high category, despite seeing a downward trend. So here you can see the national aggregated line in black, the Northeast in green, the South in kind of this lime green yellow color, the Midwest in red, and the West in blue. And you can kind of see we had an increase in detection starting in April, kind of across all regions, and we've seen a little bit of a peak, but we don't know if we're done with the season yet, so we're going to continue to monitor this. But we've started to see concentrations come down across the board. Right now, there's a 64% positive detection rate across all sites in the WastewaterSCAN network. Next slide. And here is a quick map of where we're at. So the Midwest is in the low category due to a number of these sites not having any recent positive detections for EVD 68, but the West, South, and Northeast are currently in the high categories due to frequent detections and high concentrations being detected in those samples. Next slide. And I'm going to hand it over to Marlene.
Okay, we had a lot to get through today, so I'm going to try to be quick. We just want to remind you that there is this new regional overview on the website. So when you go to the dashboard, you see that bar at the top where you can search for a location or click on the different regions. You can also click this new purple button, Regional Trends, and this overview will pop up. This shows you each of the different pathogens that we're monitoring and shows that breakdown that Amanda was just walking us through with all the different regional aggregated data. You can change the timeline over here if you want to see different time periods, and you can download the whole thing as a PDF, which is really easy to share. So we've been using this a lot and loving it. So I hope you are taking a look at it and it's helpful to you too. And then I think the last thing we want to talk about is this respiratory virus campaign. You should have all gotten an email from us yesterday that included a link to a bunch of these resources. So as we're heading into respiratory virus season, our communications team has created, not me, our communications team has created this amazing campaign to talk about respiratory viruses and encourage people to look at the wastewater data to see what's going on. So we've shared a toolkit that has all of these assets in it. So you are more than welcome, and we encourage you to use this and post these yourself. We have versions in there that have the WastewaterSCAN logo and that don't have the WastewaterSCAN logo. If you like to kind of share the content but you don't want to have the branding on there, that's fine with us. So this is all totally optional and just a resource that we've created to share this data with people this fall, that we wanted to share with all of you. And we would also love to hear your feedback on it. If you have any thoughts, we always appreciate hearing what you think. So, and thanks, Anna. That's so exciting. I love to hear you say that. I think, let's see, was there anything else? So yeah, any questions? We are at time. So, if everyone wants to head out, see you later, but we'll hang on for a few minutes for questions. Julia, there is not any H5 specific messaging in that campaign. And I did see a question. Somebody brought up pertussis. Alessandro answered this. We're working on pertussis. It's tricky. It's a tricky bacteria, but we are working on it. So rest assured, we're not like prioritizing other things over pertussis right now. Exactly. And we hear that. I really appreciate the feedback that people are very interested in pertussis. Yeah, any other questions? Lin says, from the regional overview page, is it accurate to say the West is the lowest COVID level compared to other regions? Amanda, do you want to answer that?
I'd have to look at it again quickly.
I think we do want to kind of be cautious about comparing exactly apples to apples across different regions because we have slightly different representation. But we can definitely say that right now our overview of COVID in the Western region looks low, but I would caution against kind of comparing the exact values, knowing that we're not having sort of a perfectly representative sample of each region, I guess. I'm going to stop sharing and